Hi everyone, my name is Caden Lee, and today I'm going to talk about vitamin D as my micronutrient presentation. Okay, so what necessarily is vitamin D? Vitamin D is a fat-soluble vitamin that is naturally present in very few foods, and they can be fortified in the foods as well. The reason we call it conditional vitamin or prohormone because dietary source is not required if synthesis is adequate to meet needs. Also, we know we can get vitamin D from dietary supplements. And there are two types of vitamin D. First one is vitamin D2. It's obtained from foods naturally, and sometimes we can find them from the fortified foods and supplements. And the other one is vitamin D3. It is in a lesser amount and provided by sunlight. It can be synthesized in our body as well. So now we're going to talk about the LDA value and UL value. For the individuals who are 1 to 70 years old, is 600 IU per day. IU stands for International Unit for specifically micronutrient that we're talking about right now. And for adults who are over 70 years old, they have to take 800 IU. And this is all based on minimal sun exposure. The UL for infants and children up to 8 years old have to take 1,000 to 3,000 IUs per day. And for those who are 9 years old or older, they have to take 4,000 IUs per day. And now on the right side of this slide, you can see more detail for individual group of the vitamin D LDA. Now we move on to the functions of vitamin D. Vitamin D promotes calcium absorption in the gut and maintains adequate serum calcium and phosphate concentrations to enable normal mineralization of bone and to prevent hypocalcemic technique. It's also needed for bone growth and bone remodeling by osteoblast and osteoclast. Other functions include modulation of cell growth, neuromuscular and immune function, reduction of inflammation. Vitamin D also regulates cell proliferation, differentiation, and helps modulate apoptosis. Apoptosis means cell death. Now, let's talk about food sources. Unfortunately, we don't have many food sources that contain vitamin D in nature. Fatty fish like salmon, tuna, and mackerel, and fish liver oils are the best sources. In the chart that is given by the textbook, it shows cod liver oil tops the vitamin D requirement, which is 680%, way exceeded the LDA for both men and women. And we see the purple groups, which are mainly proteins for the majority of the micronutrients. Small amounts of vitamin D are also found in beef liver, cheese, and egg yolks. According to National Institutes of Health, fortified foods provide most of the vitamin D in the American diet. For example, America, people drink milk which is voluntarily fortified with 100 IU of vitamin D per cup. The reasons that vitamin D is inadequate because of the following: dietary inadequacy, impaired absorption and use, increased requirement, or increased excretion. A vitamin D deficiency can occur when usual intake is lower than recommended levels over time. Since we may not receive enough sunlight, the kidneys cannot convert 25 LHD to its active form, or absorption of vitamin D from the digestive tract is inadequate. Vitamin D deficient diets are associated with milk allergy, lactose intolerance, ovo vegetarianism, and veganism. Here are the three most common diseases from deficiency of vitamin D. First of all, rickets. It means the skeleton will not mineralize normally without adequate calcium and phosphorus in the blood. for deposition in bone. This causes the bones to weaken and bow under pressure. It happens often in children. The signs of Racus include large enlarged head, joints, and a rib cage, a deformed pelvis, and bowed legs. Second, it might cause osteomalacia. It happens to adults mostly. It means soft bones. It is characterized by poor calcification of newly synthesized bone, resulting in fractures in the hip, spine, and other bones. Osteomalacia is most likely to occur in adults with kidney or liver disease, or intestinal diseases that impair fat absorption. Other adults at risk of deficiency include those with dark skin and with limited UV exposure. Symptoms are bone pain and muscle weakness. The third one is osteoporosis. More than 40 million adults in the United States have or are at risk, and since both my mom and grandma have osteoporosis for a while, I'm quite interested to know more about it. It's characterized by low bone mass and structural deterioration of bone tissue that increases bone fragility and significantly increases the risk of bone fractures. Osteoporosis is most often associated with inadequate calcium intakes, but insufficient vitamin D contributes to osteoporosis by reducing calcium absorption. It is a long-term effect of calcium and vitamin D insufficiently combined. Vitamin D toxicity can cause nonspecific symptoms such as anorexia, weight loss, polyuria, and heart arrhythmias. More seriously, it can also raise blood levels of calcium, which leads to vascular and tissue calcification, with subsequent damage to the heart, blood vessels, and kidneys. The use of supplements of both calcium, which is 1,000 milligrams per day, and vitamin D, 400 IU, by postmenopausal women was associated with a 17% increase in the risk of kidney stones over 7 years in the Women's Health Initiative. A serum 25-OHD concentration consistently more than 500 nanomole per liter is considered to be potentially toxic. Excessive sun exposure does not result in vitamin D toxicity because the sustained heat on the skin is thought to photodegrade pre-vitamin D3 and vitamin D3 as it is formed. In addition, thermal activation of pre-vitamin D3 in the skin gives rise to various non-vitamin D forms that limit formation of vitamin D3 itself. Some vitamin D3 is also converted to non-active forms. Intakes of vitamin D from food that are high enough to cause toxicity are very unlikely. Toxicity is much more likely to occur from high intakes of dietary supplements containing vitamin D, especially in the form of cholecalciferol. Above these UL intakes, vitamin D can cause an overabsorption of calcium and hypocalcemia. Excess blood calcium, in turn, leads to deposits of calcium in the kidneys, heart, and lungs. Anorexia, nausea, vomiting, bone demineralization, weakness, joint pain, and kidney dysfunction. In the early stages of toxicity, the symptoms often are treatable if vitamin D is withdrawn. Vitamin D promotes calcium absorption in the gut and maintains adequate serum calcium and phosphate concentrations to enable normal mineralization of bone. During exposure to sunlight, one ring on the molecule undergoes a chemical transformation, forming the more stable vitamin D3, cholecalciferol, which I mentioned before. This change allows vitamin D3 to enter the bloodstream for transport to the liver and kidneys. where it undergoes conversion to its bioactive form, calcitriol. The first occurs in the liver and converts vitamin D to 25-hydroxy vitamin D, also known as calcidiol. The second occurs primarily in the kidney and forms the physiologically active 1,25-dihydroxyvitamin D, also known as calcitriol. So the things that I found really interesting from the media and some researchers is the more vitamin D you take, the higher risk of developing cancer in colon, pancreas, and even cardiovascular areas in our body increases. Laboratory and animal evidence, as well as epidemiologic data, suggest that vitamin D status could affect cancer risk. Strong biological and mechanistic basis indicates that vitamin D plays a role in prevention of colon, prostate, and breast cancers. Emerging epidemiologic data suggests that vitamin D may have a protective effect against colon cancer, but the data are not as strong for a protective effect against prostate and breast cancer, and are variable for cancers at other sites. Studies do not constantly show a protective or no effect. However, one study of Finnish smokers, for example, found that subjects in the highest quintile of baseline vitamin D status had a threefold higher risk of developing pancreatic cancer. A recent review found an increasing risk of pancreatic cancer associated with high levels of serum 25-OHD. So we don't want to consume more than the limit of vitamin D to experience the toxicity outcomes. One study conducted in National Health and Nutrition Examination Survey from 1988 to 1994, analyzing approximately 16,000 participants, in which total cancer mortality was found to be unrelated to baseline vitamin D status. Colorectal cancer mortality was inversely related to serum 25-OHD concentrations. A large observational study with participants from 10 Western European countries also found a strong inverse association between pre-diagnostic 25-OHD concentrations and risk of colorectal cancer. So basically, further research is needed to determine whether vitamin D inadequacies in particular increases cancer risk, whether greater exposure to the nutrient is protective, and whether some individuals could be at increased risk of cancer because of vitamin D exposure. Taken together, however, studies to date do not support a role for vitamin D with or without calcium in reducing risk of cancer. The Food and Nutrition Board concluded that serum 25-OHD levels above approximately 125 to 150 nanomole per liter should be avoided, as even lower serum levels, approximately 75 to 120 nanomole per liter, associated with increases in all-cause mortality, greater risk of cancer at some sites like the pancreas, greater risk of cardiovascular events and more falls and fractures among the elderly. Some studies found vitamin D has benefits beyond bone and muscle health and could have major implications for public health policy, including the fortification of foods with vitamin D to tackle high levels of deficiency in some countries. Some reported that vitamin D protected against respiratory infections, and others showing no effect. Vitamin D, the sunshine vitamin, is thought to protect against respiratory infections by boosting levels of antimicrobial peptides, natural antibiotic-like substance in the lungs. Results of the study fit with the observation that colds and flu are most common in winter and spring, when levels of vitamin D are at their lowest. They may also explain why vitamin D protects against asthma attacks, which are commonly triggered by respiratory viruses. Vitamin D supplication is safe and inexpensive, so reduction in acute respiratory infections brought about by vitamin D supplication could be highly cost effective. But some studies oppose the use of vitamin D supplements because we can consume it from sunlight, and they are just some controversial topics. Here is my conclusion from my presentation. Insufficiency of vitamin D can definitely lead to fairly serious health issues. Too much of vitamin D may cause cancer, but further research is needed to determine whether or not it is true. The dietary guidelines for Americans suggest us to eat a variety of vegetables, fruits, whole grains, fat-free or low-fat milk and milk products, and oils. Thanks for listening to my presentation. You guys have a good day. This is the list of my references.